Hello everyone, welcome back to our channel. We are going to discuss clinical pharmacology, exam friendly questions, so stay tuned. All right, question and the answer. I have my reference here and we're going to rush through it. All right, so one, we have heparin types: advantage, disadvantages, adverse effects, 10 marks. So two types, we have unfractionated heparin and low molecular weight heparin. Okay, so for the unfractionated heparin, what are the advantages? It's fully reversible with protamine, has a short half-life, so it can be used perioperatively. All right. It can also be used in severe renal impairment and it's monitored with APTT. What are the disadvantages of this unfractionated heparin? Disadvantages: it needs continuous IV infusion, all right, or frequent subcutaneous dosing. It also need frequent lab monitoring, that is APTT, all right, and it has a higher risk of heparin-induced thrombocytopenia and osteoporosis with prolonged use, that is. Okay, so the other type is low molecular weight heparin. What is the advantages? Predictable dose response, all right. So weight-based subcutaneous dosing, usually no monitoring needed. All right, it has a longer half-life. Okay, so it's just administered once or twice daily. It has a lower risk of HIT, that is heparin induced thrombocytopenia and osteoporosis. All right, and it also has a better bioavailability. What are the disadvantages of low molecular weight heparin? Okay, it is only partially reversed by protamine as compared to the unfractionated one. It accumulates in renal impairment, so the dose had to be adjusted so that you cannot cause further damage. It cannot be fully monitored routinely with APTT, so it needs anti-factor 10A levels for monitoring. So what are the adverse effects of heparin? One, it can cause bleeding or hemorrhage. It can cause heparin-induced thrombocytopenia. Okay, it can cause osteoporosis. It can cause hyperkalemia due to aldosterone suppression. It can also cause skin reactions or at the injection site, or injection site hematoma. Right? Rare ones, alopecia and elevated transaminases. Okay, that's done. Number two. What are the 5 potential adverse effects of beta blockers? Okay, so one, we have bradycardia or heart block. 2, bronchospasm. We have fatigue, reduced exercise tolerance, cold extremities or worsening of peripheral vascular disease. We have sleep disturbance or nightmares, vivid dreams, things like that. Okay, masking of hypoglycemia symptoms, especially tachycardia. We can also have sexual dysfunction or erectile dysfunctions. These adverse effects of beta blockers. And the last one, we have possibly depression. Okay, that is done. Quick question and answer. What are the classes of antiemetic drugs, mechanism and example? So the first class, we have dopamine, D2 receptor antagonists. They block D2 receptors in the chemoreceptor trigger zone. Okay, it's just brief question and answer. So we have dopamine, D2 receptor antagonists. They block D2 receptors at the CTZ, chemoreceptor trigger zone. So example, we have metoclopramide, domperidone, haloperidol, pardon me for the pronunciations, this pharmacology, these drugs. So two, under classes of antiemetic drugs, we have 5-HT3, that is serotonin receptor antagonists. So they block 5-HT3 receptors in the CTZ and vagal afferents. So examples of these drugs: ondansetron. I just give one example. 3 class, we have Antihistamines, that is H1 antagonist, they act on the vestibular nuclei and the vomiting center. Do you know what is the vomiting center? Go and check. Example, we have cyclanizine. Yeah, something like that. The fourth class, battery low. Anyway, I think we can continue some few more minutes. The fourth class, we have antimuscarinics or anticholinergics. They block the muscarinic receptors in vomiting center and vestibular systems. Example, iosine. All right. Number 5, we have neurokinin 1, NK1 receptor antagonist. What do? They block substance P at NK1 receptors. Example, aprepitant. Okay. 6, we have the sixth class, corticosteroids. Unknown exact mechanism. Why is it telling me that? But they reduce inflammation and may modulate neurotransmitter systems. Example, dexamethasone. The seventh and the last class, we have benzodiazepines. They reduce anticipatory nausea, all right, via anxiolytic effect. Example, lorazepam. Okay, I think these questions, all right, has it helped you somewhere? At least we've covered 3 systems. Yeah? All right. So kindly subscribe, share this video, comment, let me know. This was just like a quick summary, revision, question and answer, straight to the point. All right? See you next time. Bye-bye. Subscribe. Don't forget to subscribe. Support this channel. All right? Subscribe. See you next time. Bye.